I think supervision is just as much about development of the person who's being supervised and the supervisor themselves. And I think that's really important to think about that when you are a supervisor.
Training of supervisors in this role is absolutely crucial. It's not an easy role. There are a number of pitfalls that you can come across, some that you really won't be expecting, some of them quite difficult. If somebody particularly is upset about what happens at work, which need to be addressed very quickly and carefully, because as much as we can be as supportive as we like, we can't stop those circumstances from happening. So we need to have those supports in place. It's a thoroughly gratifying role, but it's also very challenging.
We've been trying to develop some supervisor training in some areas, and for example in emergency medicine there is supervisor training days that anyone who's been a supervisor has to attend in order to supervise somebody working in advanced clinical practice roles. And in those days there is information on the role, the level of competence, how they're going to be assessed, and how they continue to be supported in practice. But this is something we're really thinking about as a trust and trying to think about how we can develop more support for those supervisors. So how, for example, are they going to support somebody who's struggling, or indeed how do they support somebody who's really excelling in their role?
So supervisors across our trust, a lot of them are medical supervisors, and many of our senior ACPs are supervisors as well. And the only resource really for supervision development for them currently is the medical model, which doesn't necessarily fit. It does work to a point, but it doesn't necessarily fit. So certainly in our trust, we're currently creating a supervision model which is far more suited to this framework and will encompass the other pillars of practice.
HEE, certainly in my region, is setting up multi-professional supervisory training, which is a blended learning package of online training and face-to-face. And I think that face-to-face in particular is the time to address those nuanced differences in supervising different healthcare professionals.
We're looking to develop the ACPs as clinical supervisors now as they become very established in their roles. And we're doing that by buddying them up with an educational supervisor, so someone who's got more experience in supervising of trainees. So we'll buddy the ACP supervisors up with someone with more experience till they can take on that role independently. We've got a site that we use that has all the key information that they may need as supervisors and signpost them to additional training they may want to have, or certain handbooks that they might need for certain courses, for instance, the non-medical prescribing handbooks. So we've got lots of resources available for people, but I think having a forum where people can share tips and tricks for supervising ACPs would be really helpful. And it's definitely something that we're looking to do in the future.
I've learnt a lot by taking part in local faculty group meetings where consultants speak about their trainees, because they've had a lot of practice in that. So for instance, they will say they're very good at gathering information, but perhaps not so good at knowing how to deal with it or how to synthesize it, etc. And it just puts it in a frame of words that is really easy for you to kind of then translate to your trainee.
The other thing we're going to try and do, which we've taken from our London colleagues actually talking to them, is to put on some web-based forums for the ACP supervisors and actually record those sessions, and with a sort of training program about how to supervise an ACP. How is it different from supervising a junior doctor, for instance? Sometimes they find it a little bit difficult knowing where to pitch things for the ACPs at first, but spelling that out to them can sometimes prevent that dip in confidence, because they may expect the ACP to come in with a certain level of knowledge, for instance, on anatomy and physiology, and depending on how you trained or where you trained, there's a wide variation in that but actually acknowledging what they do bring to the table, which is the years and years of experience in the practical management of the conditions that they used to see in the clinical areas where they work.
In Derbyshire, we felt that we wanted to invest some time and resources into developing some of our more experienced advanced practitioners into supervisors for others. We utilised some of the tools used by our medical colleagues when they train GP supervisors and adapted them to make sure that they were applicable to the multi-professional team as it develops going forward. We've found that this has really helped our senior practitioners and team leads in feeling confident and more able to supervise their trainees in the workplace.
In my environment, some of the challenges have been around not knowing how to deliver good supervision, not really understanding how to tailor it to individuals, and also being in a position where I've had to provide supervision perhaps for clinicians who've been in the job a lot longer than I have, which presents some difficulties and also some nervousness on the part of the person delivering the supervision. One of the things that I found really helpful, particularly as part of my master's, is looking at trying to sort of almost level the playing field in terms of the relationship between the supervisor and the supervisee, rather than it being this sort of teacher-learner relationship, going back to a much more facilitatory role and actually looking for ways that you can support the individual, understanding their individual learning needs and working out ways to help that, rather than this idea of I am going to impart knowledge on you and you're going to learn.